Ihinda riri ndithanyite mugeni witu rucini rwa umuthi uri tuko tukinyitanira hamwe nake nigetha kurunga maundu matiganite megie ugima wa mwiri na uhoro wegie wellness routine uri fati gukora ugisheka kana health care yako kana ugima waku wa kimwiri we uria kwagirire na uri fati gukora ukirora maundu maya nigetha gutigirira ati wina ugima mwega wa kimwiri. Mugeni witu aumete kuma thibitari wa St Francis Community Hospital kuma mwena wa Kasarani na mugeni witu tiuge ni Joyce Nyathira Maina kuma thibitari wa St Francis. Karibu sana.
Kuangalia.
Yes, karibu sana.
Asante sana.
Yes.
Horo wako muthikiriria wakwa. Na muthikiriria witu. Amaritwa njĩtagwo Joyce Nyathira. Ndĩ nurse kũu thibitari-inĩ wa St Francis Community Hospital.
Yes.
Ũrĩa wĩ a few kilometers from the Roysambu roundabout.
Yes.
Along Mwiki Road, like 5 kilometers away of 8 minutes. It's a 8 minutes distance. Umuthi ndiha kwarĩrĩria ugima wa mwĩrĩ na ku encourage each one of us gukorwo ari aware wa mwĩrĩ wake no process iria na mbere mwĩrĩ-inĩ wake. Wa mbere ni wega guikara ugithimagwo tonginya weterere murimo wa kunita niguo utengere thibitari. Ni wega guikara ugithimagwo kwindo twikaga tugithimaga cia guikara ukimenya mwĩrĩ waku uhana atia. Ni wega guikara ukimenyaga urito waku uhana atia wa mwĩrĩ na urito ugithima urito uthimagwo pia na height. Wathima na height, that is uraihu waku niguo ikuhe BMI. Na niguo hote kumenya within that BMI kana mwĩrĩ waku wi healthy kana nduri healthy. Okorwo nduri healthy ukona mtaalamu niguo agagutara how to go about it na niguo gaikara wi within the normal BMI, the normal weight na niguo wigiririe mirimo iria yukaga na urito wa mwĩrĩ. Na at the same time no wega wikara ugithimagwo kindu twitaga blood pressure. Kuu ni kuhura kwa thakame uria thakame ihuraga kuma ngoro-ini ikisambazwo mwĩrĩ-inĩ waku. Ndikwendekana ikorwo iguru kana ithi muno. Koguo ni wega ugaikara ugithimagwo na niguo ugakorwo ukimenya mwĩrĩ waku kana wina blood pressure kana nduri na blood pressure. Niguo okorwo winayo urigitwo tene niguo ndikarehe complications. Most of the time treat complication iria gukorwo kwi uru. Koguo ni wega guthimwo tene niguo utangikire uthina ucio tene. Ni wega guikara ukiroragwo maitho especially with this time of computers na mobile phones. Ni wega guikara withimagwo maitho niguo okorwo maitho maku ni maraikwa affected ni utheri ucio wa computer kana thimu ugathondekwo tene na uka-advise tene niguo ndagika ya mwico ndugaikare na thina wa maitho then riria maitho mathukire nawe nduramenya niki kiuru na ringi ni undu ungiagiriririe. At the same time ni wega guikara ukiroragwo magego like maybe after every 6 months ukavisit dagitari wa magego akakurora magego maku ria mahana na agagutara njira ti wega dagika mwico riria igego rigeire irima nirio ra advice uhoro wa root canal kana kurutwo. But kama ulio ni uguthite ku dagitari tene na waroro thina waku wa maitho wa magego na watarwo tene ni uhota gutangikira thina ucio na kugiririria thina ungi munene guka. Kwa ladies ni tuwega ni wega kuikara ugithimagwo githimi gitagwo cervical screening, cancer screening. Ni kuri pap smear na ni kuri VIAVILI. Ni wega guthimwo niguo in case there is some growth irenda gukura ukamenya tene na ugatreat tene. As well ni kuri test ni kuri a breast examination. The breast examination ona ni turutaga andu aingi ona memuce magaikara magikaga the routine breast examination niguo ku rule out any cancer tene niguo undu tangikirwo tene ni ukoragwo wi easy ku manage na muturire waku ni ukoragwo wi better. Ukiariria twikire ni hindi urero ringi ni ukwambiriria chemo ni ukwambiriria radiotherapy ugakorwo ringi wi off wira maybe watwika also a burden to the family. But undu ucio wikitwo tene wamenyeka tene it is easier wikate kutangikira. For men, we advise them to do PSA, prostate service antigen. It is a test iroraga gai ya thuri kana anake uria ikarite. When the test comes out as a high one, ukamenyekana ukona dagitari tene ukatreatwo tene. If it is normal, you are advised to continue screening frequently. Yes. Then kore test share tashukari, random blood sugars. waikaikara ni wega guikara ugithimaga cukari taru kwina kiurugari kingi muno kira prompt andu kunywa mai muno kwa mundu ringi urauga ndiranywa mai muno ni undu wa kiurugari kiria gikuo but probably aranywa mai muno murimu wa cukari the first sign ni kunyota muno tondu cukari ni urangaria mwiri waku koguo wanyota muno Regiti kiurugari kiu gikuo ni wega guthimwo cukari niguo kumenyekana kana murimu wa cukari winaguo kana nduri naguo. So there are tests that are more prone to men and the other ones are prone to women, but there are those that are general for both.
Okay. Tugioka hari test iria wakorwo kigweta hoka ni uhoro wigie airetu tabiriri na cia airetu.
It's okay.
Ya airetu hena test ya cervical cancer ya gukorwo kiroro kana wina cervical cancer na nigire kwina pap smear
na viavili
nakorwo gitutariria uhoro wigie pap smear na viavili. What is the difference?
For pap smear when you're doing the screening you get a sample itwaragwo lab ikarorwo under a microscope ikonekana how the cells are. For viavili ikago how no kage na the results how the nurse kana murigitani uroreka test iyo ni akohota ku advise how kana niona any changes ya the cells ta iria imwirine waku na gako advise accordingly. Okay, kuri yage ko advise kurigana na uria dona we need now to do a pap smear or to get a biopsy niguo ithimwo. Yes.
Okay. How can you horo wigie test ici cia cancer, cervical cancer hari atumia kana mwana wa muiretu here maugaga hena miaka uhoro wigie miaka no na uhoro wigie how often should you go to ni test very intense oka ni uhoro wigie maita maigana mundu afati gukoro agiko such a test ni maita maigana mundu afati gukoro
wagire gukoro gika yearly it should be yearly then for viavili we don't do for women above 50 years because of the structure or to the ikoraga then gukona changes ya structures. So viavili is advisable for 50 years and below. Pap smear is advisable for any ages but also mostly for 50 years and above. Yes.
Okay. Na kogo ni ufati guthie test ici ni once
in a year. Once in a year. Then after maybe for example when a patient ugeka maybe January eke test hiyo but before the January next year yokete that is kumanisha 1 year I develop some symptoms that could be abnormal bleeding. It is not, you see there's the monthly bleeding we treat periods na ni kore abnormal bleeding and it's not supposed to be bleeding at this time but you experience some bleeding. There is also pain or some discharge ti normal. And there is also pain, and especially for women who are married during coitus, mundu akaigwa ruo dagiro kokoro ki experience ruo. So when such a case happens, you also advised to do a test niguo kuonekana ni thina waku ni thina uriku ngikorora kunita. Yes.
Okay. Koguo ni ritare mwe hari mwaka no agikorwo kwina
symptoms ni cioka it is advisable to do a test. Because by the time turogeto nine mwaka umwe you can imagine the damage gukorwo ikoseto mwirine waku.
Na ni wega gukorwo kimenya maundu maya onaga tene nigetha kurigiriria a lot of damage. Okay, horo wigi the breast examination no koro gitutariria the breast examination ikagwate.
Okay, onore to thomithagia our fellow patients or even our neighbors, our sisters. The breast examination should be done monthly. Yeah, monthly. Because you see, even during when we are having menses, there are changes in the breast in your experience. So it could be a normal change and it could be an abnormal change. Kogo advice aga mutumia enyuba gwake gicicioini akairora akona the size of the breast normally kana ni ciganaine though normally anatomically emone slightly bigger kidogo tu ile you can't even notice the change but when you notice the change it means there is a problem. Okamo advice arugame mbere ya gicicio a lift moko iguru there is a raising of the breast. So if they rise equally it means there is no problem. When moja ikibaki chini ujauzito it means hena dhina. So then the next ekaga ni ko examine ko palpate the breast ko rule out kana hena mass. so agathie in a clockwise motion na akarigireria na the nipple afila mass agiro guthi thibitari ndagitari amwe examine na ni agwika the same palpation na mutume maybe an ultrasound but if there is an obvious mass ago kuniako ata wika kindu twitaga FNA fine needle aspiration aspirate some fluid the fluid igatũmwo laboratory igekĩrwo cytology mũrwaru akaheo results kuringana na gataro kuringana na results icio.
Okay. Koguo breast examination ufati wika o mweri
monthly. Yeah, it should be done monthly.
Okay. Na uhoro wigi kahinda ka mweri ni ufati wika kahinda ni kau ka mweri kana ugeterera
after. Yeah, after.
After kahinda gaku ka mweri nĩkũreka the breast examination. Thengio mũno makiria.
Among also the routine test, it is also to do the HIV test.
Okay.
You see, normally exposed. We are all exposed.
Yes.
Somebody could be having it, and then we may involve you in an accident.
Yes.
There is mixture of blood.
Yes.
So for you to be safe, it's always good to do the test. Reta ithe tukoragwo thibitari health workers. Kwena ginya ithimi gitwika ta hepatitis B, which is also important even for the health workers and the ones who are working in hotels to prevent to spread to other people.
Okay. Kogo no horo wigi kurora horo wigi mukingo ni wega ni kwagirire.
Ni kwagirire. It is important.
How often?
After every 3 months. After every 3 months. Okay, there is after every 3 months, but if you are not exposed, you can give yourself a window, a wider window, ya retest. But if you are exposed, after every 3 months is important. And especially now mothers who are also expectant, ni wega ko mathima niguo tumutare ndakahote ku spreadera mwana wake.
Thengio muno makiria. And sorry kihoro wigi athuri kana atumia. Yes. Toke hari athuri he test wakorwo gitutarire etagwo PSA. Nokoro gitutariria maingi megi PSA. Hoka ni horo wigi athuri.
PSA ni odoga etagwo prostate service antigen. Ne korago in the prostate ithimagwo thakame-inĩ but the normal range 0 to 4 0 to 4 and then wathimo if it goes beyond 4 it means there is some growth that is occurring. Though it could be growth or it could be some infection to cystitis, that is inflammation of the bladder. So wana yathimo ya tukare iguru hanini there is another test eco prompt wika. We can also do an ultrasound of the prostate gland yonekane the size of it. Ino nayo to advise aga after the age of 40 because that is when likely ikora yabagia kuhana ta ira develop some growth.
Okay.
Yes.
40 years and above.
Yeah, 40 years and above.
Okay.
Then after you do the ultrasound, you can the state of the prostate hana. Then you see a urologist and you advise more on how to go about it. There are ways to most of the time like 4 to 10 we don't name it as malignant. We refer it as benign.
Yes.
We don't come it a benign prostate hypertrophy to do it is mild na cancer and then it may enlarge ninenehete kuriko the normal way. Then the more you stay with it it becomes now malignant. Malignant means now it is cancerous. Na odo it means now it's like a complication. Either undergo removal, it could also be metastasis to other regions in that area. Could be transferring through blood even to other further ends. So the moment thimo na yonekana the changes, action should be taken.
Okay, ni horo wigi athuri neo mafati na rugani 40 years.
Yeah, about 40 years.
Okay. Aya akuma 40 guthie na thiri itestire ku mafati gukorwo magiko.
Okay, they can also do the PSA, but it might not have so much significance.
Okay.
But for them, like ruling out the HIV test, like the women, also a urine test. Yeah, urine test, just a urinalysis to rule out any infection that could be there. But you see there are some others who are prone to like an infection of the bladder. Na rimwe eukagata tahoroto wa prostate cystitis wakatohoro wa so modo iwakaru kanini maybe when passing urine it is always good kana maybe the urine is dribbling dirauma uria wagirirwo kuma stream uria yagirirwo kuma arathugumo hakuhi. It also could be some signs of infections. Agiro ndakaignore undu ucio, agiro ku visit ndagitari, ndagitari amu advice mo.
Okay. Aniwe athuri aingi matiendaga guthii thibitari.
Na matenda kuigwa ni arwaru njira icio, matenda kuigwa ni okay, it is denial kana rigi akaigwa guoya guthii ku expose mbere ya mundu thina utoyo. But when early treatment, early management prevents complications. You see, gaita ya block, it is sad, gaita ya block, it can lead to even kidney diseases. Because kidney diseases in the 3 levels. Pre-renal, intrarenal na post-renal. Pre-renal, it means gayo nila block madhugumo kuma. Post-renal nila prevent madhugumo kuma. Tondu nira obstruct njira ya mathugumo itigo, so mathugumo mau magakorwo makiretain thiini wa mwiri waku ni magukause infection itigo. The other thing, mahota gushoka back to the bladder. Mashoka back to the bladder, then igakorwo na igakorwo, it's like maka form ta stones. No na ta stones sika block tatuhiga, so sita maybe the kidney stones. Mafika thutha ucio mutheri ukaigwa ringi riu nginya you are now a candidate of even dialysis. There are cases that have pent and you also now kona mundu uyu is a candidate of dialysis just because of the prostate ire agire kutrito
o tene koguo athuri ni wega ona inyo mugathiaga test ukarorwo mirimo teno nigetha kurigiriria damages cia gukinya kuri ati ginya kwena prostate. Hoka ni horo wigi shukari nikuwetete horo wigi mundu gukorwo agithimo shukari na hoka ni horo wigi shukari no korwo gituteithiriria hena aria maugaga ona no hote gukorwo agikorwo ndungihota guthii thibitari he uria ungirora he uria watutariria ati ona kwa ihinda riri ni undu wa urugari uria wikuo he andu aria maranyua mai muno na no wecirie ati uranyua mai ni undu wa urugari no dariri imwe ya gukorwo ati wina shukari ni ati ni urangara muno.
Dariri imwe ya gukorwo wina shukari ni kungara muno among others. Ni undu wa shukari ukangaria mwiri waku riu ugatuika ni uranyua mai muno any time of the day. Also loss of weight, it is also a sign of it. Then it is advisable gwika routine testing cia sukari ugathi kwi thibitari. Okay, ya kiambiriria ugukorwo thiete thibitari ugathimo niguo kiro ka sukari waku wi normal kana nduri normal na ugathomithio what are the normal ranges. That is 3.5 to 5.3. Iyo ni ya mundu utari na sukari. But riu kuri mundu ngiuga ndingugura ka machine muci ndithimage no na onethimai na ndathomithitio ndangimenya which is low which is normal. So ni wega kwambiriria na thibitari ugathomithio na nginya ugathomithio uria urithimaga then what to do after. In case iko juu, you are supposed to come to the hospital niguo wambiririo dawa na uheo mataro ma even nutrition niguo hote umenyeru ni kiuriria kia ku avoid.
Okay. He mundu rori uhoro wigie BMI tukuwetete hau tukiambiriria na he uria itakoragwo i balance kuringana na weight yaku na height yaku. He uria uroje riu ingihota atia ku reduce the weight angikorwo BMI ti njega. It is not okay na nieremetwo fio gukorwo agikurukia his weight. Yes. Riu
mundu tocho tungimutara one nutritionist amotare iria angihota kuria cia low carbohydrates. Mostly we advise on low carbohydrates because high carbohydrates, wana waririo high carbohydrates mwiri waku ukoya the enough. The other one is stored in the body as fat na ni utumaga weight ikoroho. Then to advise mundu tosha gwika frequent exercises and as well ndungihota kwambiriria exercise also ugotonete ndagitari. No ukorwo ni ndu uritu ucio ni developete hypertension borimo wa high blood pressure. So wambiriria gwika kwi exercise ugika sikorwo ni interfere bado na blood pressure yako. So it is always good kuona ndagitari or some exercise physiologist mundu kumutara with your kind of weight. This is the exercises you're supposed to do and this is the diet you're supposed to take.
Okay. Kwa ukoro balance normal BMI if you ukoro iriha
25 and below.
and below. Okay.
Yeah. Okay, kore uria tungiuga 12 in an adult is too low. Riwo sana tabagia kumusaririria indo cia ku build. And then now 25 to around 30 tukauga it's like normal. Yathi beyond 30 tukabia kuga hena overweight, hena obese. Now even those ones are also malnutrition. Malnutrition is to gukoro wina mwiri muhiju.
Okay.
Malnutrition also we overweight, kana we obese. Yeah, malnutrition is two way.
Okay.
It is either underweight or overweight.
That's
yes.
also malnutrition.
Malnutrition. Okay. Yes.
Malnutrition can be either way. Either you are overweight, kana we
underweight. Yes.
Okay. Check up ya gukoro ugishekwo mwiri wako and the BMI and height and weight. Ifati gukoro iri how often?
You can do it after every 6 months.
After 6 months.
After every 6 months it is advisable. Yes. Because 6 months is a lot of time. You see, from maybe tugewekete the last time January, and then you do it at around June or July.
Yes.
Kena changes sigikoshe okaite mwirine wako. So and then any change the tests are not so invasive. Kidona nikidurathimo blood pressure, nikidurathimo sukari, nikidurathimo maitho, magego, invasive. Titaure turauga pap smear ni kido invasive.
Okay. Koguo ni wega thutha wa mieri 6 ugathi gwiko search test. Okay.
But also now when you feel also the symptoms, tayo excessive dustiness, rigigego ni riratura, ndukuga ni daroretwo January ndikinyetie muthenya wa kuroro. Asa it is always good kukati in case there any symptoms irako trigger ukona dagitari.
Okay. Na tutingiaga kuhutia horo wigi kiria kirathi na mbere kwa ihinda riri, the excessive heat, na andu ni marakorwo magi complain muno ona ngwiciria ni thinisho kinyanithia ni wonete uhoro wigi andu kuga there is that excessive heat. Andu marauga tungihota atia gwika uhoro wigi mwiri witu kwirigiriria na maundu mangi. Hoka ni uhoro wigi kiria kirathi na mbere kwa ihinda riri, urugari ucio wikuo mundu angihota atia gutigira ati mwiri wake you stay hydrated, ni uraikara wega gutigira ati ndunagi ginya na mirimu.
So it is always advisable when you have a balanced diet.
Okay.
On top of the balanced diet, hydrate your body. By hydrating your body, ni kunywa mai like 3 liters in a day. In a day, I mean the 24-hour clock.
Yes.
Na kwe mundu wiraga in a day agakoria 3 liters, kahatiru wira ungeguruta no kunywa mai, no kunywa mai tu. But then 3 liters it's not a lot.
Yes.
Because 3 liters were dividing 24 hours. Let's say uranywa ka 500 liters. Ukanywe rushini 6 a.m. unywe 9 a.m. unywe 3 by the time urarikia kunywa netutufa only 6 of them. Iti huo niguo to make the 3 liters. Yes. So at least 3 liters in a day in 24 hours is advisable. And a balanced diet. Matuda kwa wingi ni moto advocate ka muno.
Thank you muno makiria. He andu marahuthira maybe some product, I don't know kana ni kuhota gututara horo wigi product iria andu aingi makoragwo makihuthira tuge ciothiu cia ngothi nigetha ati kurigiriria uhoro wigi maundu maingi. Even there are some who use the lightening product nigetha ukorwo agiteithia mwiri wake na njira imwe kana iringi kuringana nawe. Is it advisable?
No, you see the way we have been created.
Yes.
We are beautiful in the eyes of God.
Yes.
Even in the eyes of other people. I think probably ni mundu wionaga tatari muthaka te muiro muno. Akabia rigita kwambia kwihaka those brightening creams niguo eruheta mundu fulani kana akarirate weru no ndu fulani. Which is not the same. It's not the case. Owo betone ngai uwa kumbire, there is a reason and he was happy the way aliku created. So the brightening creams they damage our skins. We are so not supposed to use them. Nona gothi yaku gwethodeketo ku protect. Actually the most important kiga or an organ thini wa mundu is the skin. You can imagine eco protected every part of their body, the internal organs. It is a protective organ and it is the largest organ in your system, in your body. So you should also take care of it by maintaining orihana. So I think a good shower, maguta patare mako brighten, maguta mako brighten mena chemicals. Those chemicals weaken your skin. When they weaken your skin, wacino nĩ kariũa kanini rays icio cia riũa they are prone to cause cancer ya skin. So I would advise mũndũ etĩkĩre ũrĩa hana na etĩkĩre kĩ ũrĩa hana ndagathĩ kũhũthĩra the brighten creams because ugo beto muthaka ne dentro na ni muthaka I think no yora feel ti muthaka by the time I decide kuhuthira indo icio but okay uthaka ne uthaka na okay I can't generalize uthaka ni atia but I don't think God created kindu gicungi itigo
anyone
no with the toria thaka the way you are uri muthaka uri hana the way I am or the muthaka or anybody uri hana kana ni mwiru kana ni muiru kana ni mũraihu kana ni mũkuhi kana ni mũtungu kana ni mũceke ako tu salve yako and before the eyes of God Ngai ndonaga mũndũ mweru kana mũiru ĩtigwo no ithe tuonaga mũndũ mweru kana tukona mũndũ mũiru but I think acceptance ya ũrĩa mũndũ ahana is the key and avoiding using those harsh chemicals nĩguo mũndũ eruhie. Okay, there are some now who are too light nginya mĩũmbĩre ya ũrĩa hana and they tend kuigua maybe riũa nĩ rĩkũmũcina tondũ rĩu angĩkorwo ũrĩa mwerũ ngothi yake nĩ gũcinwo nĩ riũa it is the same on ũcio mwerũ agũcinwo nĩ riũa. So for those they are friendly so ciĩta sunscreen cithondeketwo na ikahĩtũkio nĩ the board they are safe to be used. It's okay to use them. Irehitoketio. But also we have also dermatologists. Even in our hospital we have a dermatologist. Kwe mũndũ ũngĩ feel maybe ngothi yake hana ni arona some changes. Reke oke thibitari onone ndagĩtarĩ amũtare. With this you're supposed to do this. Dawa ĩno kana ona ti dawa. Maybe avoid sun. You know na to nginya ni to advise mũndũ rĩngĩ wathi handũ hena riũa ĩkĩra ngũbia ĩrĩa gũkũ screen ũthiũ ĩkĩra nguo cia gũkũhumbĩra cia ũrĩa ndũgatuĩke so much exposed kĩrĩa-inĩ kĩa riũa kana ũgaikara away from the sun if you can but if you can't kwena njĩra icio ingĩ cia kũgirĩrĩria x-ray rays icio cigi cause cancer mwĩrĩ-inĩ wa mũndũ.
Thengiũ mũno makĩria tũcokereria tũkorwo tũkĩhutia ũhoro wĩgiĩ the 5 levels of healthcare well-being nĩ ũkoretwo wahutiria of cameras nĩ tũkorwo tũkĩhutia ũhoro wĩgiĩ the 5 levels of healthcare well-being koguo mwĩrori ndũgathiĩ kũraya ririkana twĩ hamwe na Joyce Nyathira Maina kuma thibitarĩ wa St Francis Community Hospital mwena wa Kasarani nĩwe twĩ nake rũcinĩ rwa ũmũthĩ thĩinĩ wa tabarĩra ya gũgĩthererũka tũrathiĩ na mbere na gũkorwo tũkĩmenya maũndũ maingĩ megiĩ ũrĩa ũbatiĩ gũkorwo ũkĩrora ũgima waku wa kĩmwĩrĩ nĩgetha gũtigĩrĩra atĩ we gũtirĩ ũndũ ũragũthĩnia gũtirĩ extremes atĩ mwĩrĩ waku ũrakũgia to that extreme nĩ ũbatiĩ gũkorwo ũkĩrora maũndũ matiganĩte na nĩ arathiĩ na mbere na gũkorwo agĩtũtarĩria nĩ thutha wa ihinda rĩigana atĩa ũbatiĩ gũkorwo ũgĩthiĩ thibitarĩ na ningĩ nĩ arakorwo agĩtĩtĩrithia makĩria atĩ ona thengia wa gũkorwo atĩ nĩ ũrathiĩ tuge thutha wa mĩeri 6 nĩ ũbatiĩ angĩkorwo kwĩna any signs ya mĩrimũ nĩ ũbatiĩ gũthiĩ thibitarĩ nĩgetha ũhote gũkorwo wa gũgĩcekwo. Nĩtũcokereria oro rĩngĩ nĩ ngatho nĩ gũtũikara ikuhĩ gũkũ nĩ gwa Kĩheo TV kĩhumo kĩa wĩtĩkĩrĩku ngĩhoka nĩ ũrathiĩ na mbere na gũkorwo ũgĩtwamũkĩra na njĩra ĩrĩa yagĩrĩire. Arĩa mũratwandĩkĩra ndũmĩrĩri kũrĩa mwena wa Facebook asanteni sana. Thiĩ na mbere na gũtũma kĩũria gĩaku angĩkorwo wĩna kĩũria o gĩothe kĩgiĩ ũgima waku wa kĩmwĩrĩ kana ũgima wa mwĩrĩ no ũhote gũkorwo ũgĩtwandĩkĩra kũrĩa mwena wa Facebook nas mũthenya wa ũmũthĩ Joyce Nyathira nĩ gũkorwo agĩcokia ciũria cianyu ciothe na nĩgetha gũtigĩrĩra atĩ o nawe ũgima waku wa kĩmwĩrĩ nĩ wahota gũkorwo ũkĩagĩrĩra ona makĩria. Ririkana twĩ nake haha aumĩte thibitarĩ-inĩ wa St Francis Community Hospital kuma kũrĩa mwena wa Kasarani just a few meters kutoka roundabout ya Roysambu na no hote gũkorwo ũgĩkinya ona thibitarĩ-inĩ ũcio nĩgetha kwamũkĩra motungata matiganĩte ma kĩmwĩrĩ na nĩgetha ũtigĩrĩre atĩ ũgima waku wa kĩmwĩrĩ nĩ wahota gũkorwo ũkĩagĩrĩra ona makĩria. Tũrakorwo tũkĩaria maũndũ matiganĩte ona megiĩ ũrĩa ũbatiĩ gũkorwo ũgĩcekwo ũgima waku wa kĩmwĩrĩ ũhoro wĩgiĩ weight, height, BMI, ũhoro wĩgiĩ blood pressure, ũhoro wĩgiĩ gũthimwo cukari kũrĩ atumia na airĩtu. Tũrakorwo tũkĩrora ũhoro wĩgiĩ cervical cancer na breast cancer ũrĩa ũbatiĩ gũkorwo ũgĩcika maũndũ maya mothe na test iria ũbatiĩ gũkorwo ũgĩkwo twarora ũhoro wĩgiĩ pap smear na vilevile na nĩho twahota gũkorwo ũgĩka uhoro wigi breast examination nigetha gukorwo ukirora uhoro wigi breast cancer hari athuri njokoro tukimenya uhoro wigi PSA icio ni uhoro wigi gai kuri athuri na ni akora gitutariria maundu maigi na uhoro wigi shukari uri ufatie gukorwo ugithima shukari na una maundu maigi megi uhoro wigi kurora ngothi yaku nigetha gutigirira ati ona mwiri waku ni wahota gukorwo ugikara na njira iria yagirire ntoshokereria ororingi Thengi muno kuri we uthiete na mbere na ukoro ugitwariria mama Keperez Davido kuma mwena wa Juja Town. Thengi muno makiria ni guikara mitambo ni Geoffrey Gathiro Jeff kuma Kasarani. Thengi muno makiria Betty Kasarani. Thengi tu hamwe muno mitambo ini. Thengi muno makiria following closely. Asante sana Ngai akurathime. Margaret Shege, good morning to you. Thengi muno makiria mwena Rafael Njoroge mwimbaji kuma mwena wa Ruiru bypass. Kanini Mbuthi watching and learning a lot. Thank you so much. Agikoro na kiuria o giothe no hote ukoro wa gutwandikira nigukorwo ngimurika ciuria cianyu na nas wa muthenya wa umuthi kuma mwena wa St Francis Joyce ni gukorwo agicokia ciuria cianyu ciothe. Twashokereria ororigi karibu sana tena twashokereria tuutie horo wigithe 5 levels of healthcare well-being. 5 levels of healthcare well-being. Twambiririe na nishigana itharo no kote gucigweta tukiambiriria tushirikane tuko tugishuhutia imwe kwa imwe. Yes, we have the 5 levels ya healthcare well-being. That is ugima wa mwiri niguo utuike successful. Yes. Guikara muturine waku wega na guikana kuruta wira waku ria kwagirire. We have 5 levels. Ya mbere ni promotive. Promotive ni not promotive, ni preventive ni kugiririria. Ni kugiririria ni maundu maria twikaga niguo tugiriririe kurwara kana kugia na mitino. Then secondly ni curative. Curative ni uhonia. No wagiririria kwi hindu ngoremo ni kugiririria undu na eventually utuike ni warwara. So curative ni the second level na ni kuhonia ni ri usikaga thibitari niguo uhone. Then hena the third one ni promotive. Promotive ni ta kugathiriria kugathiriria njira cia ugima wa mwiri to tureka haha. This is promotive niguo andu mamenye niki wagirwo gwika ya kugiririria kugia mirimo. Then hena rehabilitative. Rehabilitative ni riria wagia na rege murimo kana wagia na an accident na watwika mwiri waku riu ni ta watwika incapacitated. Ndungihota kuruta wira na njira ria yagirire kana no nginya wikare wikaga undu fulani niguo mwiri waku gaikara uri mugima wega. Niyo itago rehabilitative. Ni kugeria gucokia hinya mwiri-ini waku niguo uhote guikara ta andu aria angi nomo. Then hana palliative. Palliative ni the care tuheaga arwaru aria mena a chronic illness. Kwina mirimo tuga ndingihonwo ta murimo wa sukari tuga ndungihona sukari but you can control it. Kindu ta blood pressure tikuhono honaga ni ku controlaga. Tondu once wagia diabetes wagia hypertension tikuga ni ukahona ni kugiririria urigiragiria guthie extremes either too low or too high. Tu ugatuika ni urathie thibitari na uranywa dawa to put it under control. Murimo ta cancer ni tura ungihono kuri mundu uga ni athire chemotherapy agitinio hau hari na cancer na ana believe ni kuhona honire. But there are also chances once umepata you can also get again. Ogo wagire cancer hau agire you don't know probably toko ni hana ka cell kamwe kamu vite na thakame gagaikara handu fulani handu hagi. Then handu hau guo hage some weakness over time rigi ekaumoka na rigi. It happens. It will remissions. So there are the 5 levels. That is kugiririria, kuhonia, kupromote, rehabilitative na palliative. Yes. Okay. Kogo palliative ni ya kurora andu aria mena mirimu ino chronic iria tahonagwo no nigetha mundu ucio aikare comfortably tari angi. You see patients are cancer
maikaraga na ruo ruingi muno. Cancer is so painful. Ina ruo both psychologically and physical pain.
Yes.
So we want these patients also to enjoy life comfortably. Tutikoda tondu mundu ucio na cancer agaikarage na ruo hingo ciothe. Maybe ni patient utarahota kuria, ringi ni cancer ya mumero, darahota kuria. So in palliative tuka make sure ni arahota kuria. Even if dakuria ringi na kanua, kwina other methods ciikiragwo cia mundu ucio kuhota kuria. No hekiro ka tube hau daine agekiro irio direct, kana no ekiro kamufira through the nose kathiete nginya nda gakufindaga murwaru ucio. So those are palliative. Tutikuga tondu mundu ndarahota kuria reke ithe twirire we ndarahota kuria, it is not fair to that person. Koguo riu nikio rutumita palliative care. Palliative care onayo ina components ciake. Hena mwena ucio wa irio, hena elimination, hena even them they need exercises. No kone mundu tangihota kwiyumia haria njagota riwa, no muruteja athiote riwa. Even cancer patients are a stage kiria 4, they are also in palliative. Tondu you cannot go back to maybe stage 1, but riu hariore we also have to give you care to make sure you also living comfortably. Yes.
Tukiambiriria na the first level, the preventive, no hote gututariria niki ufati gwika nigetha kurigiriria mirimu teno ya cancer, mirimu the chronic nigetha ndigakinye ha palliative care now. Mirimu ino chronic. Niki tufati gwika nigetha kurigiriria.
Preventive, to mirimu ya cancer giragiririo, ni nginya to mirimu tungita like diarrhea, you ensure you drink safe water. You also ensure wherever you are not in a crowded place. Iyo ya kokoro in a crowded place nigiragira respiratory infections, TB, na maybe tuhoma tungitore hinde ya COVID tugaga keep distance. Yeah, you don't overcrowd. Arafu ni kurina indo ta boiling water, maybe doing exercises, going to the hospital to visit the doctor to do the routine tests. There is palliative iginita ko eating a balanced diet. Yes. Isho shode ni preventive. Niwo igeririe tukage murimu. Gweka test taisho sha screening sha cancer, the PSA, the cervical, the breast, even vitu kama colonoscopy, endoscopy, all those are preventive. Okay, some could be diagnostic riria urwarire, but no get riri ndikoragwo na thina wa kumeria muno nigoda kumenya niki kiwitumaga njigwe ndirahota kumeria kindu. So when you go and do an endoscopy, it could be you may pose a normal test, kana you may na thina. So riria yauma ina thina ukatreat tene, because maybe a biopsy will be taken, or when the endoscopy is being done, ndagitari akohota kuona ni thina uriko winaguo no treat tene.
Okay.
Actually the major iria ikugaga uhoro ria muingi ni preventive. Yes. Kugiriria kugia murimu. Is even the same turara gari she is safe. Shikiro speed governor ni kugiriria accidents. Shagiriria accident, it will not occur. But if you don't adhere to preventive, an accident can occur, an illness can set in your body. Ko ritare turashana brush your teeth twice in a day, avoid eating sugary things. All those are preventive. Cia kugiriria.
Na kwiragwo ona kurigiriria ni kwega gukira kuhonia.
It is true. It is even cheaper. Kuhonia uguthie thibitari ringi wadimitwo. Ado makaumana kuma goka kukuona ni marahuthira time marahuthira fare. But riria wagiriria you are still maybe at your home level.
Koguo ni wega kurigiriria gukira ona kuhonia. Oka ni hori rehabilitative no hote ukoro ugitutariria oringi riria turayihoro wigi rehabilitative tutarakinya hari palliative. Rehabilitative turayihoro gaki.
Rehabilitative ni kugeria gucokia mwiri waku back to normal. Dialysis is also a rehabilitative process. Kwena mundu akirwara maybe high blood pressure, arwara high blood pressure affect a side effect affect the kidneys. The kidneys ikia kuruta wira na njira njega na ugituika rino watuika wa mundu wa dialysis. During those process of dialysis you are trying to rehabilitate you to live a normal life. Yes. Nitagushokia mundu. Nita mundu akagia maybe accident, akagia injury ya guoko, maybe a crash injury ugathie theater guko ukageria guthondeka gukarema maybe ndagitari agakora tondu thina ni urathi na mbere na ukahaha tukukurengera haha you see once warengero haha ndungihota kwandika ndungihota kuria ndungihota kuthie na mbere na normal wira na guoko ku so we train you with this other hand how to go about your normal duties so we are trying to rehabilitate you back mundu akagia fracture ukakiro plaster kana wikiro cuma kuguru ugatuika ni ura walk na clutches ndungiukira ugo wambia ku walk na clutches no ginya rehabilitate kana train kuhuthira clutches icio
so rehabilitation ni more of training
and incorporating you back to do your normal you see wake accident ikuga ni ugo waku no athira you are now done asha so you are also helpful so do not, it is not every part of your body imekuwa injured goro yaku ni njega your brain ni sawa and then you maybe guoko kumoneko wega kumoneko kwina thina but also no kono moko meri mena thina they are also what to do prosthesis and those processes are also examples of rehabilitative yes depending now on your severity of your problem
no hota gutariri kana thibitari ni wa St Francis Community Hospital ni mukoragwo mukineana motungata maya mothe turakora tukiaririria na gikorwo kwina motungata mangi mukoragwo mukineana no korwo gitutariria ni motungata mariko ta thibitari wa St Francis mukoragwo mukineana kuri arwaru
ru hau ne hotogwagira horo wa curative wa mbere tu oigero gwo thibitari nabe gohe na bashi thimu iria maybe no kohe mundu thaici ungikoe na kiuria no hure thimu kuria no kwi mundu rari gondoriria ha mitambo-ini ni guteithika fine guteithika with the word of mouth no kuri uri urauga atiri no nyende guka kuona ndagitari ucio na bashi to cia thimu ni 0741 689983 0741 689983 kana no uhore 0795 431 113 0795 431 113 ni ukuhota gutaro ni njira iriko na ni ndagitari uriku ngikuona so services cia tukoragwo nacio waigira hena casualty ni ta tumitata it's like the face of the hospital na niho ili kire emergency services sitangikagiro maybe na emergency to road accident peke yake kwi mundu ngi ori mwangini to maybe ni kathina ga kuhuhia andu ake mamurehe na tumutangikire na oxygen kwi mundu ngi uka ena ruo rwa gastritis uke tugutangikire na tukuhe dawa ya ruo na kwi mathina maingi maria mekagirwo ate ona patient uroka na severe diarrhea diarrhea mai magathira mwiri woka kindu kiambia woka tuguthime tuone ringi skin yaku ri ohana maitho magatika sunken tugakwambiriria mai maku replace mai ma uruzite yes tugakwambiriria riu icio ciothe nicio cikagirwo hara emergency okay kindu ta igego niguo ni emergency ku mundu raturwo ni igego bari ucio tutimwamukagira at emergency tumwamukagira at the dental clinic agathi direct kwina dental clinic yes toka mwamukira dental clinic hari dental clinic riu ndagitari akwamba muherigi dawa na mu examine one thina wake ni uriko na mutare kuringana na thina uri naguo then twina nginya clinic ya maitho kwi mundu ngi ukena thina wa maitho tumutume kwa maitho na ndagitari wa maitho ahote kumuteithia kwina ndagitari wa ciana tona tunini specialty wa pediatrician okay kwi mundu uguka akwire kana gakwa kakona thina no yes kwi ndagitari ungimuona but because there is a special doctor ungimhota kumutara badala ya kumuthururukio tukamutuma direct kwi pediatrician akahota guteithia mwana wake kwina gynecologist so ni ndagitari uria wonaga atumia na twatumia atheri niona nginya athuri aria mena thina wa wigi reproductive health yes then kwina clinic twitaga ya mental health you see with this it's also now coming na wigi mental health ukona kwina mundu kaunduka karamuthinia ikarite uguo kana mundu ucio nikinya atwikire depressed ndagatuike depressed uguo muci eke visit the mental health ataririe ndagitari thina wake ndagitari ona you see kwi mirimu ifataraga counseling makaria na the counselor na twina clinical psychologist no amutare na njira njega na kwi mamwe mafataraga ndagitari maybe mundu ni arwa ndikomaga kana yakinya thaa 9 toro wakwa uraga fiu koguo ni akubatara ngikuona ndagitari niguo ona akionago ni clinical psychologist ni akuona ndagitari the mental health doctor niguo ahote kumuhe dawa cia kumu calm down. Then twina ndagitari tumetaga urologist niwe wonaga cama kona thina wa njira ya mathugumo urologist or maybe ushawina thina wa ngai kuna mundu ushawina thina wa cystitis anything to do with the bladders the urinary system hena ndagitari ucio then hena ndagitari twitaga wa ENT ear nose and throat thina wa mato manioro na momero hena ENT akaga every Tuesdays na Fridays na ni akuhota guteithika mundu ushawina thina ucio. Then we have a specialty twitaga surgeon, a general surgeon. The general surgeon you patient rigetora kwera ndiago ni daha ho gario ni da maybe we kona ultrasound ya kona thina wa appendix riu fatara kona maybe a general surgeon niguo aguteithia na thina ucio waku. Kwina orthopedic ndagitari wa mahindi na kwende mahindi mao marikite ni arthritis either the knee the hip ni twika procedure citagwo total knee replacement kana total hip replacement. Then we have a very big laboratory test yo the rede kana ni kuhota gwikirwo kou. The same time tuna big radiology gwikirwo CT scan ultrasound x-rays and it is timely and real time ukaheo report ya kure yagirire. Then we also have the wards the outpatient the inpatient wards kure ari wadu in case murimo waku ni tona ndungihota guthondeka na winuke tugako admit for a few days ukagia na dawa cia mukiha niguo uhone na ihenya. Hena maternity hena nursery ya ciana hena ward ya general wards hena ward ya ciana twina ICU twina renal unit a patient aramekagirwo dialysis weekly maybe 3 times in a week or 2 times in a week ni moka na tukamekera dialysis na magaikara miri yao na iri no motare yake. Then we also have theaters, operating theaters na gutiri na jamii ya theater hena theater maternity na hena theater general hena theater ya orthopedic. Tikuga wona woka tugukwambia gukwira wetere mieri iri nirio muthenya waku ukonekana
na he mundu withini wewe
eterera hena operating theater and personnel mararuta wira na njira njega. Then twina ward itago executive ward iyo ni ria wigwa mundu ni ndiri wa kirathi kia thibitari no ndiri wa kirathi kia iguru andu othe all the way na kukunene ona haha haitu ni gukana tukohe the executive ward ina room yaku self contained room mili yako katika kile urenda kuria muthenya ucio tikire thibitari ra ku dictator menu ya thibitari mothe hano then ina TV yako kero kurathi na mbere na ukaigwa wita mucii away from home. Then we also do test endoscopy na colonoscopy. Endoscopy twika through the upper colonoscopy ni ngi twikaga through njira ya kioro. Then twikaga bishata echo twika ECG and they are all part also of the well-being. No ukire uge ngoro yakwa ihuraga ndi ni kihuraga daitari no ke kana ukauga no nyende gwikobisha fulani niguo one ni kigituma ngoro yakwa ihure uguo na hena kekege hena kindo damage kwa asha na kiki damage auria guthingiriririkanaga no guthingirika nigukurite ni tukona ndagitari wa dermatologist wa ngothi na bado wa chest because tena mirimo ya ngothi thiko ici ndiwe ni kitwa na tuciarago ukaigwa after like a few days kana kena eczema although they relate with diet kiria mutumia araria but also ni mwandu fataraga kuona ni dermatologist ni gwagatara mutumia maybe kiria riria during pregnancy and even pregnancy na mwana ucio ria kufatara kuroro niguo eczema dikamo affect mono.
Thank you muno.
And we have a very good nutritionist uria tutarakira tukuria mirire and physiotherapy nene muno ina ginya gym na ni to invite ginya outsiders me register na the gym to keep our bodies fit.
Yes. Okay. Koguo ona ko ndo murwaru no ke gym kwena andu mokaga gym ona ti arwaru but ya me general kukujanga gym. It is possible. And there is a nutritionist. Why tondu jugire both malnutrition ni overweight na underweight. Yeah, you can imagine rigi na kana no akarehe kliniki higo ciothe alafu kwina ira tugaga the path the normal path agiro kuthia kiginaga weight oria karakora kagiro gutika kiginaga weight but ukona rigi kangi handu agathie the normal path maybe karathi uguo kana karathi gacokete thi no mama ni akufatara kuona nutritionist niguo atare mutumia ucio uria mwana wake agukora na njira njega in the normal path. Okay. Thank you muno. Paul Wandimi, good morning kuma mwena wa Nyahururu town rigi ni gwikara mitambo-ini ngai akurathime. Rebecca Mustangi kuma mwena wa Zimmerman, I love the show, asante sana, God bless you, to be blessed. Thank you muno. Mother Ngarari, asante sana, rigi ni gwikara mitambo-ini mwena Mimo Joy Rahab, thank you muno. Anthony Gashunga, asante sana thank you muno. Makere Rafa Njoroge mwimbaji, good morning, praise the Lord, thank you so much, thank God, asante sana, tuwashokia gatho kuri ndagitari niguka ututara guko gwa Kiheo TV. Thank you muno muno. Makere ngai akurathime, asante sana. He mundu rori horo wigi supplements kana ni wega mundu ukoro akioya supplement riria ari tuge ni ena kamurimu kana underweight kana horo wigi supplements tutaririe horo wigi nili mundu fati
supplements ni shamitheba mingi muno. You see even calcium is a supplement. Kwe uri ongi kwa thibitari ndagitari athime the levels of ya calcium shikoro shithi akohe calcium but it is also a supplement ni kindu gyothe turi ya gitari irio-ini magnesium calcium kuri ingi supplements shikoragwo cithondeketwo like formula food ta ensure patient a cancer gini ona mena maraheo ensure glucena yago patient a diabetes niguo ndika affect sukari wao duka thiguru uria makiria uria wagireire. So supplements on nation shiho but it is not just advisable kwe mundu ringi urendia supplement agokaga ko approach agakwira wajiko nona supplement eno ni njega muno na mwiri waku, then you just go there and start taking. It is good to see the nutritionist niguo akwira atiriri mwiri waku wina deficiency ya supplement eno no wagiro kumihuthira tondu wahota kumihuthira na mwiri waku winayo enough na tugaga ningi kindu giakiria it also becomes a problem. Calcium yegi hamono mwirino waku no thina yanyi hamono no thina but wana dagitari and especially the nutritionist akwire kurigana na ithimishi wekiro haha ndio na wina thina wa supplement ni urafatara supplements ni aguko advice na ko advice accordingly. So tutigiwa supplements ni juru but ihuthiro uria ciagirire
over the counter.
Don't go over the counter. Okay, sikata even that person is in the market onake rigi no wira araruta wetha ginya onake mutu wake it is okay but ti mundu wothe wagiro kuhuthira supplements. Kwe mundu rigi urakore ni omega 3 and maybe your body does not need that omega 3 sini ukweli and it is okay to promote that person the business wise but also check on your body. There are some people maybe hena mahuthira supplements icio sigathi gathukia mwiri wa mundu ucio itona ugakutwika riu ningi nwage na complications ingita indo twitaga ta pulmonary embolism igatwika they also costly kuthondeka but when advised by the nutritionist ona ndari na supplements icio no ko advice arako advice okay no akorwo nacio na no akorwo atari nacio but no okomo approach umwire these supplements I came across and is it advisable if I can use it? Akikwambia it is advisable, go for it. Akikwambia it is not advisable, don't, because you will now be going against your body needs.
Okay, kogo ni njega angikoro ni utarĩtwo nĩ your nutritionist gũkorwo ukioya the supplements, na ndukeire tini ndirabatara ro supplements ya kĩndũ
as ndungikire uge ni ndirabatara, you have to be done an evaluation ya kuoneka ni urabatara, so that ndugathi overboard ya mwĩrĩ wako.
Yes, thank you muno makiria. Ndio kana heno ndungi utigitie uhoro wigi ugima wa mwĩrĩ, wellness routine and healthcare evaluation tukirekereria
otokirikagiria ni ngumaririkania nyumite thibitari wa St Francis wejira ya guthie Mwiki kuma Roysambu roundabout around 5 kilometers. It's a drive ya 8 minutes. The ritoine nemo norirona near St Francis Hariori. It's a level 5 hospital, so it has all services. Na specialist all the kuina ginya madaitari mareruta kuina school of nursing, so we are all ready to awaiting kuteithiriria murwaru ucio. Services icio ciothe datho matukoragwo nacio cikuo ciothe available. Na even among the routine test niguongerera test igigire muhimu, a total blood count and a kidney function test. Tondu rimwe wiguaga test ira ta elderly aradimito na low sodium levels, na low sodium levels irariho ningi elderly na arare mokuria okaigwa direda kana raria tunini tukaigana. So even the kidney function test nigukonia the sodium level, nigukonia the potassium level, nigukuonia creatinine na urea mwĩrĩ-inĩ waku uri hana. Total blood count igukuonia your HB, your white blood cells, your platelets, na HB ethĩ ni ugutaro ria wagiro gwika. If it is normal, it is normal, it is okay, hatire mataro, only that keep doing what you are doing to make sure the HB ni sawa sawa. In case there infection, you kuheo dawa cia treat the infection. Then in case there's some people also who have high HBs, nituma advice maka donate, tumita therapeutic donation, maka donate thakame ka donate ro mundu ungi uri urabatara. Tondu igwa mundu ariago ni mutwe agatengerera ka paracetamol kana kamara moja na HB oi ni HB iguru mwĩrĩ-inĩ waku, kumaanisha wina thakame excess ĩrĩa utagirwo gukorwo winayo, na hena mundu urabatara thakame yo. So it is advisable, maybe wario ni mutwe muno, thibitari ikiro total blood count okone HB iguru, do the therapeutic donation, teithia mundu ngina thakame yo hindo nginya ni gukorwo wisivite kunywa paracetamol yo takwagirwo kumenywa.
Thank you muno. Mundu gwetwo once the joy aruga horo wigi mental health, aruga mental health is very key as well. No hote ukorwo ugitutariria maigi mental health na the services that you offer when it comes to mental health.
Yeah, we have mental health clinic na ikoragwo 3 times in a week. That is Monday, Wednesdays and Fridays, and adhibitari toto ina clinical psychologist. So when you come to the mental health, ogo gukwirite patient no okay one the mental health doctor, the psychiatrist amuonae one udoyo na tiwa dawa urafatara the clinical psychologist, akumurifa to the clinical psychologist na amwaririe tugaga when you speak something you problem shared is half solved. Yes. So ariria the clinical psychologist ni akuigwa ni iganira, tondu clinical psychologist ni akumutara on coping mechanisms. The doctor, in case the patient ni horona suicidal, ni horona maybe lack of sleep, maybe nira affect, okay, tunituga nita organic, kwe organic na non-organic. Agiko ni non-organic ni akufata kuona dietary amuheda maybe antidepressants, but at the same time maguthi hand in hand with the clinical psychologist. Tondu there is a time maybe patient oyo anano athimu cione tata anateithika, tondu rimwe nduhonaga pap wahota kunywa dawa after 3 days 4 days ni rorabia kuigwa effect ya dawa, but kwe mundu ngithire gianywe dawa ndari na patience enough arafu udosho mulipokire. It's advisable when you have the mental health clinic, we have the clinical psychologist. Yes. Now, especially it has also been put as a problem here in nation, especially during the time of COVID. Mental health now it is there. It is to be acknowledged. It is there. Many people are suffering. It is true. Kana mundu reka ka undu abnormal it is good also kuinquire harĩ mũndũ ũcio na kuona ũngĩmũteithia atĩa.
Okay. Atondu aingĩ ao there normally in denial. Matiĩtĩkagĩra ona gũkorwo akĩarĩria mũndũ. Mũhotaga atĩa kũmahandle rĩrĩa moka kũrĩ inyuĩ?
You see, like the mental health doctors and the psychologists, they have been trained how to go about it. Nikio tura advice, ndugakorwo wina thina kana wina mũrwaru wina thina wikare nake muci tondu nona hari we arakwira ndiri na thina. But the doctor and the clinical psychologists, they have been trained how to go about this patient. Na ukaigwa ni ma open up. Nginya ndivyo na we uma na mũrwaru kwenyiti na thina ona kana ona we ndukona gate na thina. Na ukona ni ma open up and within a few days mundu nginya agacokereria wira wake na agathi na mbere na muturire wake uria wagiriire. You see, kuna hii kiundu giki kia kwenda mbeca cia na ihenya, betting, and then you lose and then you become suicidal. Kwena maundu nginya ta mau no hari mundu ndaretikira gukwira ni what went on. But akikuja hospitali ni akuhota kupenepera ndagitari akamwira by the way my problem is 1 2 3 but according to you niko tu sawa ndona. So tondu thi aya memuci matitrainetwo how to go about dota urenda kwira kiria wakawekirwo BMI the nutritionist kana ndagitari uria wakuona ni akuhota gukuguide according to this what you can do guguteithia. Urologist hau wewe mucie wina gathina kama thugumo nduroka kumwira mathugumo makwa mena thina uyu na ringi ni uretigira but don't fear the doctor. Tamaka hau aguteithie hau okite hau rucini tukirire twethamba twaria breakfast twoka thibitari tuguteithie na wewe haria mucio uretigira kuga atiriri ni ndigũthie thibitari kuga thina wakwa no gwikana thina waku na gutiri hindi ugateithika na ni turi na kiundu kiu tutiukite haha utwire na ithu tukere angi mena wina thina uyu ukite tuguteithie niguo hote guikara na njira njega. So don't fear, come to the hospital, get the right treatment, prevent complications.
Thank you muno makiria. No kuro gitunegereria namba cia thibitari oro ringi nigetha angikorwo mundu ena kiuria o giothe kana no ende guka thibitari no hote gukorwo akimukinyira no tarĩrie oro ringi kuria thibitari ukoragwo tukirekereria.
Thibitari witu njitagwo Joyce Nyathira ndi nurse ku thibitari yo miaka mingi ndirira andu imwe ni manjue na makarigo koya toire guku ndoire ku ndimwetagire na ndimuthondekaga na ndimuheaga service iria ciagiriire. Thibitari ni St Francis Community Hospital wijira ya guthie Mwiki from the roundabout ya Roysambu about 5 kilometers or 8 minutes drive. Wakinya hau gate-inĩ there is a big name ya gukuonereria St Francis ni guku. Ona matatu waingira matatu uginjira St Francis gutiri mundu ukuria kuu niko. It is well known. Na hana roundabout ringi ya mwena uria ungi wa Njiro. Ona yo Njiro to Mwiki to St Francis. So ni kama iko katikati ya from Roysambu to Njiro. Namba cia thimu ni 0741 689983 0741 689983 kana no uhore 0795 431 113 0795 431 113. Tugukaribisha uke na nitwamugeithia inyuothe mwe muci muratuthikiriria na thengi guthuthikiriria na mu practice the 5 levels of healthcare niguo tugie na ugima mwega wa mwiri.
Thank you muno. Preventive, curative, promotive, rehabilitative na palliative. Thank you. Gwehoka tutakram tutashika. Thank you muno nurse Joyce Nyathira ni guka guko gwa Kiheo TV rucini rwa umuthi ndikana hena andu angi ungienda kugeithia andu a muci. Nigoda kugeithia muthuri wakwa Dr. Michael Mwangi Kamau ari kure University ya Nairobi onake akiruta wira wake no nake a maintain ugima wa mwiri. Nigugeithia my mom na my dad menyire ngeithia my brothers and sisters ne kundu matikanite gutigana gukuguo na ngeithia arata akwa othe na nigugeithia andu othe aria turutithanagia nao wira St Francis na ndimetuthi na mbere na kuhe arwaru itu the best services niguo makenere na Ngai ahote guturathima. Thank you. Nigugeithia nginya madam witagwo Shiro akaha West aturite athikiritie ajiraga ni rucio yes.
Na ni muthenya ni wakinya ni umuthi no nake ngumwira a maintain kiu ndamuthomithia
yes.
niguo agie na ugima mwega wa mwiri.
Thengio muno. Thengio ni guka guko wa Kiheo TV rucini rwa umuthi nitwakena muno ni utaro waku Ngai arokurathima.
Thank you.
Thengio muno makiria. Thengio mwirori wa Kiheo TV we wakorwo wi mitambo-ini kuma riria twambiriirie tabarira ya gugithererũka rucini rwa umuthi. Ndi Brown Newton thengio muno makiria. D Brownie Kawaskari, asante sana. Gaero kurathima. Rebecca, asante sana. Awasta Joy Gehoka ni wakoro ogithoma, thengio muno. Madhangarari, Favor Darling K, Pastor Nyangi Tishibite, Rafael Njoroge mwimbaji, muma aigi muno muthenya wa umuthi. Gaero murathima na tuthie na mbere na gukorwo tukirora ugima witu wa kimwiri na nigetha Ngai athie na mbere onake na guturathima. Thie na mbere na kwirorera tabarira citu guko wa Kiheo TV. Gehoka ni wakoro ogithoma maundu matiganite kuma kuri Joyce wa Nyathira kuma thibitari wa St Francis Community Hospital mwena wa Kasarani. Ikijokere namba ciao cia thimu angikorwo ndunanyite namba ciao cia thimu no hote kumahurira thimu kuri namba 0741 638 ni 0741 689983 0741 689983 kwaranĩria na thibitari wa St Francis Community Hospital mwena wa Kasarani kana umahurire thimu ndingi kuri namba 0795 431113 0795 431113 thibitari wa St Francis Community Hospital ni omomwa hamwe na ithuĩ rucini rwa umuthi thĩinĩ wa tabarĩra ya gũgĩthererũka